today's World Insight, a diversified donor base for the World Health Organization and ways to improve the global pandemic response from the WHO spokesperson.
Now we have to be very careful and vigilant as we try to open societies so we don't go back to the huge number of people who are infected on a daily basis.
The search for a coronavirus cure. Could it be a medical arms race? The lowdown from the CEO of the Russian Direct Investment Fund.
Well, Russian Direct Investment Fund really benefited from its partnership with many international partners, including China.
And the HKSAR chief executive in Beijing. How's Hong Kong's economic and political situation? The answers from NPC deputy and seasoned HK politician Raymond Tam. Here's our host, Tian Wei.
Hello and welcome to World Insight. I'm Tian Wei. The coronavirus pandemic sweeps across the world, virtually unchecked, with 6 to 7 million confirmed infections. The WHO held its first media briefing Monday on the pandemic since U.S. President Donald Trump announced the U.S. will end funding and cut ties with the organization. The number of reported COVID-19 cases in the U.S., however, is reaching up to almost 2 million. Officials emphasize the need for testing, social distancing, and face covering amid the easing of restrictions and large protests against the police brutality across the nation. Will the ongoing protests in the U.S. lead to a spike of infections in that country? How will WHO, as an international organization, support the international community for the new normal? That's the question I asked the spokesperson of the WHO, Tarik Jasarevic, and let's hear his answers. Are you concerned from the WHO perspective about the protests going on inside North America? We have seen over the past few days it's been building up in more than 40 cities. Of course, social distancing in such case is very hard to be observed. What do you make of that situation? Are you worried from the health perspective?
From public health perspective, we are basically really repeating our advice to all countries, and that is basically to look into ways on how to reduce the possible risk of exposure, trying really to strengthen health systems, make sure that health workers have everything they need in terms of training and equipment, that people are well informed about the risks, and that really we need to work all together in finding the solutions.
In the U.S., as the official data suggested, between different races, there are different numbers, and the number could be very different. For example, African Americans tend to have a higher death rate in terms of COVID-19 than the other races in the United States. That's just one of those examples. So how do you see, Tarik, from the WHO's perspective?
Well, this is about really about universal access to universal health coverage and access to basic health services that should be provided to all. We know that countries who are doing well are countries who have exactly that universal health coverage.
Tarik, as you may know, some of the economies already opened up before scientists suggest it is the right time. Others have been closing down the borders for long. So how do you see the various governmental reactions about what to do given their own unique situations at different times?
Well, every country is facing a different situation. So obviously every country will analyze where it is in this pandemic, how situation has been evolving on their territory, what are all the other elements to take into consideration, and they will make their judgment. Now, from WHO, we issued general guidance for countries who want to ease restrictions, and we understand perfectly well that people want to reconnect with their activities, with their loved ones, that countries want to resume their economic activities. What we have said, basically, what we should try to look at as we ease these sanctions is whether we are able, again, as we have already talked, to know where the virus is. Do we have in place all public health measures to test, isolate, and treat those who are sick and look for contacts? Do public health systems around the world have enough of capacity to treat eventual surge in new cases? We also have to really look into what will be needed in terms of new arrangements at the workplace, at the schools, at all the other places where people meet, so we reduce the risk of future exposure. So many countries are looking now really how the workplace should look like, how schools should look like, universities, bars, restaurants. So we don't get to the situation where we have to go again into drastic measures, because this was already traumatizing for everyone. And yes, we have seen, for example, in some regions like North America, like Europe, that the number of newly infected people is stabilizing, decreasing. Thanks to those strict measures that have been put in place, now we have to be very careful and vigilant as we try to open societies, so we don't go back to the point where again we have a huge number of people who are infected on a daily basis.
You talk about North America. However, despite of its the most developed economy, the United States, its death toll has earlier already reached 100,000. So how do you see, in fact, the divide is not just between the rich and the poor nations, rather it is the divide of, how countries are coping are very different from how wealthy and how developed the economies are.
Well, the challenge is the same for everyone, and we have seen, for example, in European countries who have very strong health systems, that some countries have been quickly overburdened with the number of newly infected people. And countries have different experiences, they have a different geography, they have different culture, so all of that has to be taken into account. What we know is that every government on the planet really wants the best for their citizens, and trying to see what is the best that they could do, taking into account guidance from organizations such as World Health Organization. So we know that this was a big challenge for everyone, and we should not really look at pointing finger to anyone or looking into any sort of division. We were really clear from the beginning what we need is a solidarity, and that countries can learn from one another. That what we have seen, that countries who have taken examples from other countries, taken lessons from other countries, did well. So we think that this is the way to go, and one of the aspects where we really work all together is research and development. We also have scientists from all over the world sharing their work, their knowledge, and working on solutions, and this is the way forward.
The WHO Foundation was founded last week to support the organization's effort to address the most pressing global health challenges. What exactly is the role of the WHO Foundation? How is it funded and operating? Tarik also shed some light on these questions. Talking about the science, we have seen that the WHO has been trying to establish something called the WHO Foundation, trying to provide funding for research about the therapeutic treatment, a vaccine, about the research of the virus. So tell me how it works, and how should we make sure it's going to be a sustainable platform supporting research in this regard?
So last week, what was established is the WHO Foundation. This is an independent foundation that has been registered under Switzerland law, because we are based in Switzerland, so completely independent from WHO. This foundation will look into finding and raising resources for the work of WHO, not only on COVID-19, but also for other parts of our world, of our work. And the reason for this is that we really wanted, and there was a feeling that we need to expand the donor base. We need to really make sure that we can receive money from the general public, which was not the case so far from different institutions, from different sectors of life, and that this work, this money then will be more flexible, will not be necessarily earmarked. So basically, more predictable, more broader donor base is the goal of this foundation.
How much of it is part of your efforts, efforts by the WHO to diversify the funding that you've been receiving every year, and things are likely to becoming ever more complicated as a result of the latest events?
Well, exactly. We were trying for years to diversify the funding. We were not, for example, able to raise money from general public because we didn't have those provisions. We were receiving assessed contribution, as we call, that's a membership fee from our member states, and then we had voluntary contributions who were also coming a lot from the member states or big foundations like a Bill and Melinda Gates Foundation. Now, we always were trying to look how we can make sure that other sectors of society can help, and how we can make sure that this money is not earmarked for specific projects, which was the case so far, but that it can be a flexible, what we call flexible funds that we can then use as we feel that some projects are underfunded while others have sufficient funding. So really diversifying the donor base and having a more predictable funds.
Now, how will WHO use that fund? Of course, for now, the urgency matter is COVID-19, but as we move on, there might be different hotspot issues around the world, how to prioritize and eventually have the funding sufficient for different projects. Who will have a final say? How is that final say likely to come out? What is the process? Do we know much about that so far?
Well, again, the aim of this foundation is to raise money and make grants not only to WHO but also to trusted partners working in health. When it comes specifically to WHO, we work really on a number of issues. So our strategic goal in our general plan of work is really to focus on what we call triple billion, to really help a billion people who live in emergency settings, whether it's natural disasters or protracted conflicts, where we see the biggest health needs. Billion people that we would like to have universal health coverage, because for us universal health coverage is the key to healthy societies and to development in general, and really try also to get to the healthy living and healthy aging. We know that, for example, non-communicable diseases are the big problem in our societies, and we need to address them. So really, emergencies, people who live in a very difficult situations, and trying to have equitable access to healthcare services, and really try to make sure that we all live longer. From last 50 years, the life expectancy is rising.
Right.
We want those extra years to be years of healthy living.
What if, for a long time to come, we are going to coexist with the virus, COVID-19? Different countries and regions are carrying out different measures and plans. WHO has also released its 6-step instruction. Let's hear what they are and how they can be implemented. Earlier, Tarik, you argue for a systematic approach in terms of how we are going to deal with COVID-19. I remember as early as May the 13th, WHO expert during your daily press briefing already told the world that we're likely to deal with it and to live with it for a long time to come. So do we know better now? What should be this systematic approach? Do we have some structures already of this systematic approach, Tarik?
Well, first, we are learning about this virus every day. We are learning new things, and as we learn, we update our guidance on what are the best ways to fight the virus. Now, we don't know how the situation will go. It's very difficult to speculate. Likely, we will be seeing more flare-ups, more spikes, that we will have to live with the virus for certainly some time in the future, and we have to basically put in place measures as we have been putting in place measures for other diseases. Hopefully, we will get to the solutions. We will get to the vaccine. Hopefully, we will get to some efficient treatment. In the meantime, we have to focus on public health measures.
Yes. Tarik, as we speak, the Chinese students, whether they're primary students or middle school, high school, they're already coming back to their school. So to a certain degree, the society is really coming back to normalcy. At this point, given what really happened over the past 5 months, I just wonder from the spokesperson of WHO's perspective, what do you make of the temporary success we had so far, all of us?
We already discussed this. Basically, we issued the guidance for any country that as we open up, we need to look into those 6 elements. That's possibility to control the disease, having public health system in place, look for vulnerable populations, make sure that we look into the ways to organize a society in a way to reduce the risk of a transmission, and also working with the population. So every country will obviously look into more details on each one of them as countries are facing different situations and have different contexts domestically. But I think it's again, it's like what we don't want is to go back to the situation where hospitals are overburdened, and then we have to go back to restrictive measures.
Yeah. Will we have the scientists' investigation of the virus, of origin of the virus, as the World Health Assembly earlier indicated?
Well, I think it's important that we know the origin of the virus, because then we will know what was that intermediate animal species that transmitted the virus from the bat population to humans. So in that way, we can reduce the possible future exposures. So this work is very important for scientific community not only to understand the virus better, but also to understand the way how that virus got to humans. So hopefully the work that is being done will give some results.
Are we going to see how that team is being formed? What process would they use? And how would they work with your member governments? How do they work with headquarters of WHO and things like that? It seems to be quite complicated a process, I would say.
The resolution that has been unanimously adopted by the member states at the World Health Assembly puts a number of paragraphs. There are some more than 20 points for all countries and for WHO to follow. So we are looking in all of those actions that have been put forward by the resolution supported by the member states, and we have to see how we can move forward with all of those different areas of work.
Thank you so much, Tarik, for joining us. I know you have very busy schedule, whether quarantine at home or work from home or work in the office. Thank you so much, as always.
Thank you.